So before I start our press conference, I want to talk a little bit about George Floyd. And I can't imagine what that family's going through right now. It's been tough on the nation, and to see this continue to happen time and time again, it's unspeakable. I understand people's right to protest, and I encourage that, to speak up, so this stops. I had a conversation with Dr. Whalen last night, and we're just concerned with the protest because we still have the coronavirus going on and it didn't go away. So she did reach out to Citizen Action to talk to them, about the protest. I believe it starts at 1 o'clock today. Just the concerns of health and safety, because it could set us back. So I do say, I encourage what they're doing, but please have masks on, be socially distanced from each other, and be heard, but do it in a peaceful and safe manner. My support goes out to his family and to all the families this happens to, unfortunately, in this country of ours. It shouldn't, it still does, but it shouldn't. So please, to the protesters here in Albany, just do it respectful, peaceful, and safely, because we are concerned about your safety. We're concerned about you spreading the virus. We're concerned about you getting each other sick. So be heard today, but keep your social distance, please. So a variety of other things that are going on before I even get into the full press conference. And one of the things we talked about was this matrix with the state and how do you address certain numbers and people passing away and how do we track it and making sure our numbers are correct. Unfortunately, and I was running a little late today because trying to figure out how you even put this message out there. I have to report another 24 people passed away. And how do you say 24 people passed away and we didn't know about it? And I know that's a question you all have out there. And, that's why we're going into day 80. I usually do 20-hour days, and I'm not complaining. I get paid for it. This is what I get paid to do. In 12 weeks, no days off. But this is the stuff that keeps me up. When we're trying to move into phase 2, we're trying to do the right thing. How don't you know about 24 people passing away? I reported 11 on Friday, I believe. If I stand corrected, someone can tell me differently, that we didn't get now 24 more. So it brings our total up from 87 to 111. So the 24 deaths at 3 private nursing homes between late April and May 25th, meaning 5 days ago was the last one. They had been reported to the state, but not to our county health department. When we reported earlier this week that we had uncovered this, I had Dr. Whalen reach out to not just the state health department, to every nursing home in the county. I forget what reporter it was. I don't know if it was someone here or if it was Steve Hughes from the TU. Asked that question. I said, it's a great question. And we reached out to verify. So when we verified the numbers, we picked up another 24 yesterday. So I can tell you, I spent the whole night with Dr. Whalen and her team and my team going through this and making sure we got it done correctly today. But as a result, we uncovered an additional 24 cases that have not been reported to us. Teresian House had 15 deaths, 1 male, 14 females, ages 75 to 104. Date of deaths range from April the 27th to May 15th. St. Peter's Nursing and Rehabilitation had 5 deaths, 5 females, ages 92 to 95. Date of deaths were from 5/1 to 5/23. The Grand had another 4 deaths, 2 males, 2 females, ages 59 to 93, and then from April 21st to May 26th. So out of the 111 known deaths, 82 or 74% are associated with nursing homes. Still doesn't make it easy. So my condolences and prayers go out to these families, these additional 24 families that we're announcing today, And, we're there for you, and the families need us, and it's a difficult time. Regardless if they're in a nursing home or not in a nursing home, things are different. And I know as we start to open up and people are getting itchy to get out there, just think of these families, these 111 families. And, we'll continue to try to get this right and make sure that as we go forward, that you have the most accurate numbers we can put out there. It does not affect us going into phase 2. It wouldn't affect us going into phase 1 because we looked at the matrix, and that was concerning to me too. Because look, I'm not a scientist. I think the governor said it right. We're county executives. He's the governor, but we're not health experts. And I rely on our health department. I rely on the people out there that are on the front line figuring out how to tackle this and how to safely reopen and how to do things differently. So as we continue to move forward, that's why I always said safety and health of the residents come first and foremost. I know the stuff that's going on with addiction. I know the stuff that's going on, and we're going to talk a little bit about stuff like this. It is alarming, the numbers that are going up, and we're watching it. I know about the economy. Trust me, I could sit here and cry and tell you how many millions of dollars we've lost. But I'll say this again, and I said this 80 days ago. I will never put a dollar amount on anyone's life. You can't tell me one person's worth $1 million or worth 10,000 versus 100. Again, it's about moving forward in a safe manner and protecting everyone that I'm in charge of, that I represent in this county, and especially in the Capital District. So I just want to make sure of that, and I do have the numbers again to put out to people if they need it later on, but to the 24 families, my condolences and prayers go out to you. So as of today, we have 1,688 positive cases of the COVID-19, up 2 from yesterday. We have 692 people under mandatory quarantine. That's down 10 from yesterday. We stay the same course, 6 people under precautionary quarantine. 2 positive cases yesterday, like I said, which is, again, as we have aggressively been testing, that's good. We have 7 people recovered since yesterday out of the 4,510 people that have completed quarantine. So it's a total of 1,340 people that have tested positive for the virus and had recovered, which is good. There are now 20 people hospitalized, which is down from yesterday, which is great news. And again, that's part of the matrix that they're looking at, the hospitalization and the ICU beds and everything. So the hospitalization rate's 1.18%, which people have tested positive, and that's 1.6 it was yesterday, so which is a good step in the right direction. We have the same 3 people in ICUs we did yesterday, and over the last 5 days, there's been an average of 10.2 new positive cases each day. Again, I urge people, please go out, get tested, do the right thing. We have it set up for you. We have it where you can get out and you can get tested. We made it on your street corner. You got the drive-through at Albany. You have the essential workers at the Seth Q Arena. So, but for our testing for mobile, please call the number as always, 518-465-4771, 465-4771. And in the Seth Q Arena, as always, you can go online or you can call 1-888-364-3065. And, just today it's free. You just walk in until 5:30 p.m. today for the drive-through colony testing site. You need to register at Rite Aid, but for the Seth Q, for essential workers, the grocery store workers only today is free. The grocery store workers, please, if you're out there, you're doing a great job working in the community and keeping essential stuff going. Today's your day to go to Seth Q and get tested. It's free. You can just walk in there. You don't need an appointment. Just walk up, let them know that you work in a grocery store and get it taken care of. As always, our Priority 1 Urgent Care in Gilliland, who's been a great partner of us for us in the community. But we know we need to continue testing and reaching out to all communities. So yesterday, I sent a letter out to our community partners and working with our legislative Black Caucus to reach out to the neighbors to get more people to make the call and go to the mobile testing sites. Our mobile testing sites have expanded their criteria to include those with symptoms and those who have had close contact with someone who was positive. Essential workers and those who have gone back to work in phase 1 can now be tested through our mobile testing site. So please help us with this and get the word out. Like I said, we're in week 12, and we know that staying at home and not being too social is taking a toll on all of us. It is on everybody. I see it. People who have come out for walks or just in the community definitely are tired of being at home and they just want it over with. Well, I wish I could have a wand and hit that wand and it's over with, but it's not the fact, people. The coronavirus is here. It's not going away. We're going to have to deal with this until they get a way of a vaccine to take care of it. This is going to be the new norm going for a while. And we've been fortunate. If you look around this country and other places, we've been very fortunate in the fact that we haven't had the impact it has had on New York City or New Rochelle and Westchester or other parts of the state or parts of the country or parts of the world. We've been fortunate. So please keep that in mind. But I know a lot of our community members are dealing with addiction. And it's a struggle. I said this the other day. It's a struggle every day. You get up every day, it's a struggle. Every step you make is a struggle. Fighting the addiction, the want for drugs or alcohol, and you see the toll that it's taken on Rensselaer County, hit them a little bit harder, somewhat here too. We're seeing more deaths. Again, it's a struggle, and the one thing these people depend on is meetings, and they depend on seeing people, and the Zoom meetings work, and others just need to see people to know that they have that support mechanism, that they have someone they can lean on in their point of struggle. Talk to somebody that's might have been only recovered for a year or 5 years or 10 years or 20 years or 30 years and understand even after 20 years it's still a struggle. It doesn't go away. It doesn't get easier. It's just something that you have to deal with your whole life, and you have a network of people there continue in this community to be the backbone for these people that are in these unfortunate situations. And I pray to everyone out there that you're not in that situation. And I'm glad if you don't have a drug addiction or an alcohol problem, that you didn't have to deal with this. And if you don't have a loved one or a family member that had to, God bless you. But I will say this to you, it's hard for these people and they need to get their classes in. So I asked Kelly Rowe, who is the director and organization executive director, to come in from Second Chance Opportunities, to come in and talk about what they've been doing and how they're moving forward in this and how they continue to help the community. Kelly?
Thank you so much, Executive. And thank you for the amazing
just pull
job.
The mic in a little bit more so they can hear you.
Sorry.
No, you just pull the mic in.
Okay.
Sorry. There you go.
So my name is Kelly Rowe, and I am the Executive Director of Second Chance Opportunities. I'm also a person in long-term recovery. Second Chance Opportunities is a local non-for-profit, and we provide ongoing supportive services to people who are in recovery from substance use disorder. On March 19th, we unfortunately had to close our doors like the rest of everybody, but we have created a virtual community. We have Zoom meetings every day, 6 to 8 Zoom meetings a day, and they're not the anonymous meetings, they're not AA or NA, they're just gatherings of people. So people can come in and have coffee with one of our recovery coaches at 8 o'clock in the morning. At 2 o'clock in the afternoon, they're doing creative work with another one of our coaches, Kristen. We're offering one-on-one peer support, and the peer-to-peer support is really important because you're having a conversation with somebody who has that lived experience. We're also doing referrals. We've had over 50 referrals since we've shut down to mental health, physical health, really anything that anybody needs. Any family members who are concerned about a loved one can contact us. We've increased the portion of our services by engaging And we're able to provide alternatives, so, because people with the isolation, some of us are suffering from depression, so we're helping people make short-term goals like getting in a walk, doing a little exercising, having a little artwork, doing some cooking. Yeah. We're really doing as much as we can, just throwing the book at it.
So it's different times, and you had to reimagine what you're doing for treatment or reach out and talking to people. And again, I know we're in like this century where everyone has their phone in their hand texting, or you can FaceTime people, or you can Zoom. But I know there's a certain group of people that don't like that. They like to have the personal contact, and
Yeah.
I'm glad that you're working that out and still trying to meet in social distance with less than 10, and to make sure that they get the help and support they need. So Kelly, thank you to you and your organization for what you're doing in the community through these difficult, tough times.
And people can go to our website, or they can look us up on Facebook. We're having daily updates on both of those platforms, so they can join us.
Thank you.
Thank you.
No, thank you for that. And it is a difficult time, and I've said this in the beginning, you have to reimagine everything now, how you operated, how you didn't operate. It's different. It's different. I mean, even watching the news, you got one at home and you got one in the station, and you flip back and forth. You figured it out. You made it work, and that's what it's about, making it work to move forward. But I do want to say our crime victims and sexual violence center reports, our domestic violence numbers have been still low. It doesn't mean it hasn't spiked. It just means that the reporting has not, come in, and we want to always make sure that people know we have that number up there. For the new clients and hotline calls we have been getting with sexual assault cases, it is concerning because we know the numbers are rising, but people aren't feeling safe to reach out. They're not feeling safe to reach out, and we want to make sure that to let you know we're here for you. So please, as always, call our 24-hour sexual assault hotline at area code 518-447-7716. That's 447-7716. As always, our mental health hotline that's available 7 days a week from 8 a.m. to 8 p.m. That number, as always, is 518-269-6634, 518-269-6634. And as always, our New York State hotline number and 211.